Hello, welcome to our 13-step study plan. At the moment, we're going to be going over step number 1, which is a first reading, and I'm actually going to show you how to do it. These are the steps you're going to take in order to improve on your grades and your learning so that you can retain information and input it into your mind in such a way that you can withdraw it, tap into it when you need it for exams. So the first step is first reading. So during your first reading, you're going to be turning to your chapter. So this is actually a chapter on cellular regulation that I teach, and I haven't read the chapter. So I wanted to have a fresh eye and just work through it with you guys just to show you how you would be doing your first reading. So you would be doing it like this, going through the concept of cellular regulation, looking at these vocabulary words here: anaplasia, autosome, cell cycle, chromosomes, deoxyribonucleic acid, DNA, deoxyribonucleic acid, differentiation, dysplasia, genome, hemoglobin, homologous chromosomes, hyperplasia, meiosis, metaplasia, mitosis, ribonucleic acid, RNA, sex chromosomes, somatic cells. So I'm thinking some of these I might know, some of these I may not know. Normal cellular regulation, physiological review, cell membrane, cytoplasm. I kind of remember some of this in biology: endoplasmic reticulum, nucleus and nucleolus. I remember some of this stuff. Here are our tables and charts: methods of cellular transportation, diffusion, facilitated diffusion, osmosis, filtration, active transport versus passive transport. I kind of remember that. Golgi apparatus, lysosomes, genetic consideration, DNA, genes, genome. Kind of remember things on genes. I remember like that little table that we used to make. Here are a lot of the vocab here: homologous chromosomes, autosomes, sex chromosome, mitosis, genome. What's a genome? DNA in a cell, in a human cell, is referred to as the human genome. Okay. Meiosis. I know there's a difference between meiosis and mitosis. Meiosis is a type of cell division that takes place in the sex cells of the testes and ovaries. Okay, this is a cool picture here. Differentiation, alteration to cell regulation, alteration and manifestation, hyperplasia, metaplasia, dysplasia, anaplasia. I don't remember much about hyperplasia, something about changes, differentiation, but I'm not sure what it might be. Alterations and manifestations. So alterations is description, there's manifestations, there's intervention and therapies. You have alterations: cancer, anemia, leukemia, sickle cell, polycythemia. I know there's a chapter on anemia that we're covering and a chapter on leukemia, so maybe I'll focus a lot on that right there. Sickle cell disease. Oh, I know someone with sickle cell. That's a painful disease of some sort. I remember that. Genetic considerations and risk factors: cancer. Don't want to have cancer. Anemia, something about the blood. Sickle cell, yeah, something about pain. Case study. Oh, they have case studies. Andrew Lordo, an 8-year-old boy, is brought to the emergency department by his mother. On arrival, Andrew is pressing a bloody towel against his nose. So he has a nosebleed. As the triage nurse, you direct the boy and his mother to the assessment station. Andrew's mother explained that Andrew's nose began bleeding about an hour ago. Okay, this is a whole spiel here. They have some questions. Then we have concepts related to cellular regulation. Hold on, wait a second. Was there objectives in this chapter? I didn't see any objectives here. Okay, whatever. Concepts related to cellular regulation. There's advocacy, infection, inflammation. What is this? advocacy has to do with this. Interesting. Managing care, stress and coping, health promotion, modify both risk factors. That means we can possibly do something about it. If it's not modifiable, you can't do anything about it. Okay, patient teaching. All right, so discourage smoking. That makes sense. Encourage patient, especially children, to consume healthy diet. Yeah, okay. Then we have screening, nursing assessment, observation, patient interview. Another case study. This one, oh, St. Andrew. Ledoux versus French. More questions. I wonder if they answer these questions somewhere so that I know what the real answer is. I don't see it. Okay, collaborative therapy, surgeries, independent intervention, providing psychosocial support, promoting health coping. Collaborative therapies, radiation. Oh, radiations for like, oh, they talked about cancer. So radiation has to do with treatment, management of nutrition and hydration, management of treatment side effects, treatment, pharmacological therapy, more on treatment, biological therapy. What biological therapy is also called biotherapies enhances the ability of the body to use its natural defense to fight cancer. Oh, the immune system is stimulated to stop the growth of the cancer, increase the immune system cells so they can destroy this cancer cell. Okay. Some weird name there. Complementary health approaches. We have medication. We have anti-neoplastic alkylating agents. Anti-neoplastic. Neoplastic has something to do with cancer. Must be. Hormones and hormone agents. Biological response modifiers. Okay, lifespan consideration, cellular regulation disorder in infants, children, and adolescents. Right, cellular regulation disorders in pregnant women. Oh, pregnant women? During pregnancy, cellular regulation disorders can pose problems to both the mother and the fetus. Maternal issues can arise from underlying organ dysfunction, such as renal disease and pulmonary hypertension. I know about hypertension. Caused by cellular regulation disorder in older adults. Okay, review the concept. These are the questions. They put them in the back rather than the front. So we have these questions. How does impaired cellular regulation influence a patient's susceptibility to infection? What can the nurse do to help reduce the likelihood of infection in patients with disorders related to impaired cellular regulation? Okay, so we have a lot of questions here. Ready to go to volume 3, clinical nursing skills. We have skills. Oh, here are exemplars. Cancer. Are these still part of it? Yep, cellular regulation. Oh, this is a long chapter. This has to do with cancer. This has to do with cancer. More on cancer. I don't remember having to read on cancer. I think I just have to read on, unless I remember I'm gonna have to read on leukemia. And here's anemia. Oh, so these are all under the same thing. Okay, here goes anemia and breast cancer. I did not remember seeing breast cancer in my things to read. And it's still cellular regulation, colorectal cancer. Oh, here goes leukemia. I have to study on leukemia. Okay, but this is not what I'm reading right now, so I'll get to that later. So right now, I'm supposed to be reading how many pages? Let me see. I am reading cellular regulation. We have 1, 2, 3, 4, 5, 6, 7. Okay, 7 pages. All right, so that was an example of how you're going to do your first reading. And if you were able to take note, what you're going to be doing is you're going to kind of gloss through the text, looking at the vocabulary words, looking at the questions and the objectives that is asked of you, or what they say they're going to talk about. Or in this book, it's in the review section, what they say that you should have learned and you should be able to answer. You're looking at pictures and graphs and tables. You're pausing at the things you find interesting. Like for me, When I saw the case studies, perhaps I'm not familiar with case studies and I never heard of them before. So I read that section because I thought it was interesting. And then there was a section on pregnant women and cellular regulation. I thought it was interesting. So I just wanted to kind of read a little bit of it. I didn't read the whole thing. Not really interested in reading thoroughly in this stage. You're just really interested in familiarizing yourself with it. You can take more time and read other excerpts. You can look up the words and the definitions that you don't know. If something stands out to you, you're going to read through it. If it's interesting, you're going to read it. But if it's not that interesting, you're going to brush over it and just basically you're familiarizing yourself with the material. And that is how you do your first reading. Stay tuned for step number 2. See you soon. Bye.